Assalamu alaikum, salam sejahtera. Hello, everyone. Welcome to Sense with Science, and I am Dr. Jamila Mahmood. And together with me, I have Karen and Anusha, two special guests today. Well, Karen is not a guest, Karen's always been with us. So, a special guest today is Dr. Anusha Arasu, and she is a Malaysian who is now working at King's College. We are going to discuss surviving COVID-19 and managing vaccine hesitancy.
So, at the moment, I'm working as a consultant in neonatal intensive care at King's. And I've been at King's now for almost 11, 12 years.
So, Dr. Anusha, you were not then practicing in a specialized COVID ward. So, how did you get COVID?
So that's an interesting question. So I got COVID in the first surge way back in March of last year. There was a lot of infection around. So I can't to this day pinpoint exactly where I got it. It could have been in a supermarket. It could have been work. I think it's more likely it was probably work, partly because we were exposed to so much. We had to go to the COVID positive deliveries. We did have the PPE and we had the protection, but it was very difficult. And the hospital was very good and very stringent about infection control. But it was one of those things that's sort of inevitable with a healthcare professional. Literally every stream of the NHS has got it and has suffered from it. And sadly, some haven't survived from it. So I can't to this day pinpoint exactly where I got it from.
What kind of symptoms did you develop first? I mean, did you hope against all hope that it wasn't COVID? Did you really hope that it was just the flu? And how long was it before you tested positive from the initial presenting of symptoms?
The way I developed it was quite surprising. So I'd been home to Malaysia in February, and that was right at the start of when things were starting to hot up in China and in Europe, when Italy was sort of slowly going into its first surge. And I was a little bit worried about traveling. So I actually spoke to our virologist and I said, do you think it's reasonable? I even had a public health consultant friend of mine. I rang him up and I said, should I get on that flight? And he said, look, to be honest, things are really hotting up. You should go now before before the middle of the year, because you may not be able to travel. So I got on a flight, went home to KL, came back. I was actually fine for about a month. Then I did a national webinar, and that evening, it just suddenly came down as a wave on me. And that evening, I started feeling a bit hot, had a temperature, went up to 39. I felt a little bit tired, and then I thought, is it just flu, or was I just tired from preparing for the webinar? That night, the fever was unrelentless. It went on and on and on, and with hot sweats. And I was actually on call for the hospital for the weekend. So at about 4 a.m, I had to call my colleagues and tell them that, look, I'm really quite washed out. And the fevers carried on for about 10 days, 10 nights of hot sweats. And it was this feeling of absolute lethargy and energy, not having any energy to do anything at all. And I was quite lucky in the sense that I didn't have any of the respiratory symptoms of a loss of smell, all of that I didn't, the loss of taste, I didn't have any of that at all. It was mainly fevers, lethargy, and I had a little bit of the stomach symptoms of having a bit of diarrhea. But that was towards the end. It was difficult because I was actually going through house renovations at that time. So I had the illness, I had my house renovations to manage, I had food to get, which my cousin did. He came and bought me food, left it outside of the flat I was renting so that he wasn't exposed to me. And we just bumbled through the 2 weeks somehow or other.
My brother contracted COVID and he knew he got off lightly. He was only quarantined at home. But I know he felt very wretched. One, because the virus attacked the respiratory system. He was coughing almost nonstop. He was not able to speak on the phone from the 7th day onwards because he couldn't stop coughing. And the fact that he was infected and infective also really preyed on his mind. So he ended up staying in isolation for 1 month, even after the My Sejahtera app cleared him. because he didn't want to bring back the virus to my mother, who has Parkinson's and Alzheimer's and who is 74 years old. So how long did your COVID cycle play out, and what symptoms for you were the worst, and how long did they last?
I mean, I think for me, the worst thing was having the fever and the hot sweats. That lasted really about 10 days. It really eased off after I would say after 14 days, I felt like I was back to normal, back to my own self. But the sweats and the lack of sleep was really awful. A lot of my colleagues have felt the sense of real tiredness and fatigue after they recovered. And a lot of them still have it. It's ongoing, even kind of 6 months to 8 months after. I have, touch wood, not had that, and I've gone back to my normal energy levels. So it's very variable with different individuals. And it's hard to predict who is going to get the long COVID symptoms and who aren't. But obviously, knowing the cohorts that we've had in all the hospitals right throughout the world, it seems to be those with the comorbidities who tend to have the long COVID symptoms.
In terms of your experience as a COVID patient, right? Did you feel that there was a particular stigma attached to being a COVID patient? You know, like here, I know that my brother, again, when I said, did you tell your friends you had COVID? He says, are you crazy? It's akin to being like a leper and saying, unclean, unclean, you know? What was it like for you? And did you go out and publicly declare to your medical fraternity and your co-workers that, hey, I was COVID positive?
When I went back to work, people obviously knew I'd had COVID, because in that first surge back in March, April, a lot of us became ill. So when we found out that there were a lot of us who became ill, that stigma wasn't there as much. But what worried me was going out into the public. At that time, when I was having my house renovations being done, so I actually held all my weekly meetings with them on Zoom, on FaceTime, and I didn't come in. Then after about 4 weeks, when I knew I was absolutely safe, I then said to my builders, look, I have had COVID. And to be honest, this is the UK. People are very easygoing and they're very, very kind of like liberal. And they went, that's fine. You know, as long as we keep our distance, as long as we wear face masks, I'm okay with it. So that stigma almost diminished instantly. Now, the current situation with the second surge, it's almost become like normal for, people to declare they've had COVID. And there was a point where some people felt it was like a badge of honor, which I said was not a good thing to kind of harbor, really. And some people said, I've had COVID, I've managed to get through it. I said, don't be so gung-ho about it, because there have been so many people in the world who've lost their lives to this. So I wouldn't use it as a badge of honor at all.
Dr. Anusha, how did it feel to have COVID psychologically? Was there less an amount of fear because you were a medical practitioner? Or were you more afraid than a common person because you knew that COVID wasn't just a bad flu, as many downplays claim it is?
So I think I was a bit bad. I was a bit gung-ho about the whole thing. And, as you say, Karen, because I thought I was a medical practitioner, I knew that it would be okay. And to be honest, I knew I was relatively fit, except for during lockdown, I put on weight, but I was quite fit. So I thought I would be able to get through it. Of course, my mum and my sister, everyone at home, being Malaysian, they were livid and they were just out of control. I got calls 3-4 times a day. My mum crying on the phone saying, oh my God, don't go back to work, don't go back to work. I said, I have to go to work. This is my life. I have to go to work. So I wasn't too scared of it. My mum was, and my sister was. I was more afraid for the people I would be exposed to. And a lot of my other colleagues were quite ill as well. I had colleagues who, some of them were on the verge of being admitted to hospital and were managed at home with pulse oximeters. But they were ones who had underlying kind of respiratory problems. I also had a very close family friend who was also a fellow Malaysian, who is, like me, a neonatologist who very sadly passed away of COVID in the Midlands. And that was a very sad case. And when that happened, then I started becoming a bit worried. There are cases where people have had a second infection, but it's been very ad hoc. So no one's really put down one common factor for saying who's going to get a second infection or a reinfection.
I'm fully aware in the UK, home testing is quite the norm, that
Yes.
people are given the kits and they stick the swab up their nose themselves. How accurate will that be? I mean, you're a doctor, so you know how to get deep into the nasal cavity, but what about ordinary people?
So the PCR test is actually, it was done for me, it was done in the hospital. They are only starting to bring it in now, especially for the schools. They have taught teachers how to teach the pupils how to do it, but they haven't actually phased it in fully yet. What we have at home is the lateral flow test kits. So the NHS and King's and a lot of the other hospitals have given us the lateral flow. In fact, I've got one here, the lateral flow kits. And we have to do that twice a week. And we report back. So it's a test which is a little bit complicated, but after some time you get quite used to it, where you do your swab, you put it into a little container, you have some drops there, you have to wait 30 minutes to get the result. That you have to do twice a week. Then we QR scan, we all have QR codes, we scan that, and it goes straight to the hospital, so the hospital knows.
We're very happy that you didn't have any, long-term symptoms and you've recovered fully. Thank God for that. But, in Malaysia, I've also heard people saying, the mortality rate in Malaysia is so low, about 0.4%, or rather the case fatality rate. What's the point of a vaccine? And I think it's really important we tell people that long COVID is real. There are people who have difficulties breathing until now, months after the initial infection. Some people have, some neurological problems, memory loss, a sense of imbalance. I know people who are still on oxygen at home. So it is something that you don't wish for anyone to have, COVID-19. So I think this is where, it's so important as we start rolling out our vaccine program now, that we really get people to understand it's not good to get COVID. It's extremely important to protect yourself, and all the non-pharmaceutical interventions like wearing a mask and washing your hands regularly and keeping a safe distance, but also the vaccine as a very important tool to mitigate the effects of COVID onto each individual who received the vaccine. So I understand you've had the vaccination given to you already, 2 doses, right? And how does it feel? How do you feel about, getting the vaccine?
The way we found out about it is King's had obviously said, look, we've got the vaccine now. We're going to roll it out to everybody, all the healthcare professionals. And they actually sent people out to all the units to say, we've started it now, so whoever can come and get it, come and get it. I got my second, so I actually didn't have many side effects. In fact, I didn't even notice that I was vaccinated after the first dose. And I got my second dose only last week, 18th of February. And after that, I actually didn't feel much. I just had a little bit of body ache, but with paracetamol, I was absolutely fine. There are many more people in this world who've not even had their first dose, and it'll be months before they get their first dose. And my worry is I just want there to be equity right throughout the world, that everybody gets it, not just the rich, but also the poor, and equally distributed. That's my biggest worry, really.
Well, basic public health measures means that you protect everyone, but in particular, you want to target the most vulnerable. Now, in this instance for COVID-19, the ones who are really at high risk are healthcare workers, anyone who has a lot of engagement with massive number of people, but also the elderly, those with comorbidities and so forth. So I think it's extremely important that we get as many people over that line. We need to have at least 70% of our population in Malaysia vaccinated to achieve the herd immunity.
A lot of initiatives done by the NHS and the public health about trying to promote vaccination in these groups of people. And a lot of it is around what's in the vaccine, what adjuvants are used, and also historically about vaccination in the ethnic minority groups and the history that's happened here in the UK. But there have been a lot of initiatives by community leaders, religious leaders, Public Health England going into boroughs, delivering webinars, Q&A sessions to try and promote vaccination in this particular group of people. That there have been a lot of patients sharing stories, BAME patients sharing their stories of illness and vaccination. So hopefully with all of this put together, we would be able to promote vaccination in that vulnerable group of people. For the moment, this is our new norm, and this is what we have to live with. And it's all up to us to put together and ensure that we protect everybody as well as ourselves.
Well, that's awesome, because I am horribly needle phobic. I hate needles with a passion, right? But I will do my part for society, as a mother, as a wife, as a daughter, to take the vaccine just to keep the people that I love safe. And
we would certainly say to people out there that you still have to be very, very wary. You still have to take all the same measures of social distancing, of face masks, of hand washing, all the measures, and be still very wary. Despite the fact you've had the vaccine, I still think you have to stress those precautions to be taken, because it is actually no joke. It's not an illness that is just flu. This is a very serious illness with such awful consequences.
This has been a fascinating chat with you, Anusha. It's been great to hear your perspectives as someone who's not only had COVID and recovered, but also have received your vaccination, someone who's received the vaccination. I think we've had a rich discussion. And we wish you all the best, Anusha. We're so happy to be able to speak to you. Please stay well, stay safe, and I hope you can come home soon and have your nasi lemak and your good food that you miss. And when you're back in Malaysia, we must catch up.
Until then, Anusha, keep flying the Jalur Gemilang for us and make Malaysia proud on the world stage.